The birth of a baby can trigger powerful emotions from excitement and joy to fear and anxiety. But it can also result in something you might not expect, and that's depression. In fact, 1 in 8 women will develop postpartum depression after giving birth. Dr. Joshua Weiner is here to explain why and how it can be treated. Thanks for coming and joining us for Baby Week.
Thanks, Barbara.
Why don't you explain the difference between baby blues and postpartum depression?
So baby blues is this moodiness, irritability, increased crying that generally starts to occur about 3 days after giving birth and ends about 2 weeks after giving birth. It's self-limited, goes away on its own.
Is it hormonally?
It's felt to be hormonally related, as is postpartum depression. Postpartum depression, however, is the baby blues that are amplified, so people are really feeling down. They're questioning themselves. They're thinking, maybe I shouldn't be a mother. Maybe I'm not fit for this. This is going to be terrible for my family. They might even have thoughts of hurting themselves or their child. They can't sleep even though they're exhausted. When that's going on past 2 weeks, then we think that people have postpartum depression.
Is that also hormonally triggered?
So it's felt that it is due in part to hormones. So after giving birth, there's a rapid decrease in both estrogen and progesterone, and it's felt that that's the hormonal contribution to developing postpartum depression. But that doesn't tell the whole story. It's also felt to be due to the lack of sleep that people get after giving birth and having a newborn, and also just the stress associated with having a newborn.
Now, a woman who is going through this may not recognize it herself. What should her husband, her
significant other or partner,
whoever is around, what should they look for?
I think they should be looking for the sad mood. If it continues past 2 weeks, they need to be thinking maybe there's more to this than just the baby blues. If their wife or partner is really not sleeping well, they're incredibly irritable, they're crying a lot, they feel completely overwhelmed, they feel like they're not doing a good job as a mother. If they suspect that there's a problem, they need to trust their instincts and recognize that there might be a problem, in which case they should talk to their OB/GYN or the child's pediatrician, or seek out the help of a mental health professional like a psychiatrist.
Should a partner or spouse be concerned about the child's welfare in the care of a mother who's undergoing this kind of postpartum depression?
Well, in very rare cases, some women could go on to have something called postpartum psychosis, where they lose touch with reality. That occurs in about 1 in 1,000 women. Absolutely, in that case, that's an emergency for both the woman and the baby. It's only really rare that postpartum depression will actually lead to any real danger for the child. However, studies do show that kids whose mothers are depressed are delayed in language development, cognitive development, and emotional development. And it makes sense. If a mother's depressed, she's going to be less likely to interact and engage with her child, talk to the child less, and the child's going to have some delays as a result.
So are there any treatments for postpartum depression?
There are treatments, there are therapies that can take place, so supportive therapies like support groups, there's interpersonal therapy as well. You want to see your doctor because there are some blood tests that can be done, because sometimes women after giving birth have autoimmune problems. One thing that sometimes happens is women will develop a thyroid problem. So about 10% of women with postpartum depression actually have low thyroid resulting from the pregnancy, and so you want to treat the thyroid problem. And finally, of course, there's medications which have been shown to be safe and effective for women postpartum.
So is it okay for a woman who is taking an antidepressant to breastfeed?
Well, that's a real question. There's one medication, it's called sertraline. The brand name is Zoloft. That's one that's generally recommended for women who are breastfeeding because the levels of the medication don't pass into the breast milk at a high degree, so it's not dangerous to the baby. Other medications do enter the breast milk, and so you do have to be careful of that. So sometimes what you need to do is target the time where you do your breastfeeding or pumping to the times where the blood levels of the medication are lower in your body. Or you have to just supplement with some formula.
But in general, most women are very happy when those babies come.
Most are happy, but I think people do need to be prepared for the fact it is a difficult time regardless. You're happy, but it's tough.
Yeah, it is, I know, and you know.
Firsthand, yeah, we all know.
All right, thank you so much for being here and joining us for Baby Week, of course. We'll see you next week.
Okay, thank you.